let's talk about our third biomarker, which is pharmacodynamic biomarkers, which is also known as response biomarkers. These indicators are important to measure the effectiveness of a treatment, helping physicians adjust dosages, determine treatment duration, and make informed decisions about therapy adjustments. For example, changes in your heart rate or blood pressure after taking a medication are simple but effective pharmacodynamic biomarkers. Pharmacodynamic biomarkers can provide critical insights into how well a medication is working. As I said earlier, they help physicians make informed decisions about dosing, treatment duration, and necessity adjustments. So, we're talking about pharmacodynamic biomarkers for drug response. And the four biomarkers we're going to talk about are heart rate, blood pressure, serum drug levels, and gut motility. And heart rate is measured using ECG. This can be done in clinical setting or using wearables. Blood pressure is using sphygmomanometer, which can be regularly monitored at home or during clinical visits. Serum drug levels measured through blood test, and gut motility assessed using imaging techniques such as scintigraphy or motility capsule that track the movement of contents through the digestive tract. And what are these values and what those values mean? So, heart rate and blood pressure. Changes in these parameters can indicate how well a cardiovascular or anti-hypertensive drug is working. Serum drug levels. The concentration of a drug in the blood helps determine if the dose is therapeutic, too high, or too low. Gut motility. Improved gut motility can indicate a positive response to treatments for chronic constipation patients or any other chronic GI motility disorders. And optimal signals that we are looking for are heart rate, blood pressure, and serum drug levels indicate that medication is effective and well dosed, which is at the optimal level. And improved gut motility suggests that successful management of constipation and other motility disorders. And what we don't want is abnormal heart rate, blood pressure, or serum drug levels that may indicate a need for dose adjustments or alternative therapies. And obviously, lack of improvements in gut motility signals the need for re-evaluation of the treatment plan. After this, let's talk a bit about pharmacodynamic biomarkers for inflammatory response. So, inflammatory response biomarkers are particularly useful in identifying the most effective treatments for conditions such as esophageal cancer and other inflammatory diseases. So, we're talking about three biomarkers here. Number one, C reactive protein, CRP. Number two, interleukin, that's 6, which is IL, that's 6. Third, tumor necrosis factor, that's alpha, TNF, that's alpha. So, these biomarkers are measured through a blood test, and let's understand the values and meaning. So CRP, so elevated levels of CRP indicate inflammation, and decreasing levels suggest a positive response to anti-inflammatory or cancer treatments. IL, that's 6, and TNF, that's alpha. High levels are associated with inflammation and cancer progression, and reducing levels indicate the treatment is effectively managing the inflammatory response. And obviously, we want decreased levels of CRP, IL, that's 6, and TNF, that's alpha. And we do not want the persistently high or increasing levels of CRP, IL, that's 6, and TNF, that's alpha. If this happens, then obviously it may require recalibration, changes in doses, treatment therapies, and timing. So we'll have to discuss that with our doctor. Let's also briefly talk about pharmacodynamic biomarkers for other gastrointestinal disorders. So for gastrointestinal conditions, pharmacodynamic biomarkers help in adjusting treatments to improve patient outcomes, particularly in managing chronic constipation and related disorders. Let's talk about three biomarkers measured. Number one is bowel movement frequency and consistency. Remember, we talked about how to use bowel movement as a biomarker, and this is one of the pharmacodynamic biomarkers we talked about in chapter 2. So, number two, serum electrolytes such as potassium and sodium. And third is transient time measured to SITZ, SITZ marker study or motility capsules. So, how these biomarkers are taken for bowel movement frequency and consistency, obviously, that's using very active patient diaries or digital apps. So, what we require, We have talked about Bristol stool chart so that we can be standardized and reduce the subjectivity and increase the objectivity of it. So it can be used in diary or apps. So number two is serum electrolyte is measured through blood test. And number three, transit time assessed using SITZ marker study. In the next chapter, we are going to talk about the test we require to diagnose the root cause of our chronic constipation conditions. So transit time. So patients swallow capsules containing radio opaque markers, and X-rays are taken over several days to track the movement through the colon. And what are the values that we are looking for? Obviously, if you know about Bristol stool chart, we're talking about regular well formed, snake shaped bowel movements. And for serum electrolyte, we're looking for balanced levels that suggest treatments are not causing any harmful side effects such as electrolyte imbalance. And normal transit time indicates that effective motility and treatment response. Obviously, positive signals are improved bowel movement patterns, balanced electrolytes, and normal transit time. That means treatment is effective. And other than this, irregular bowel movements, electrolyte imbalance, or abnormal transit time or slow transit time indicates treatment adjustment required. So, pharmacodynamic biomarkers are essential for tailoring treatments to each patient's unique response. They provide feedback on how well a therapy is working, drug is working, and guiding adjustments to improve effectiveness and safety. So, if you are managing chronic constipation or other gastrointestinal issues, we got to talk to your doctor and pharmacodynamic biomarkers. So, understanding unique response will help recalibrate to the precise and personalized treatment plans that works just for you.